right, look at here now. Paging Dr. Adam Cohen, Glenview. Paging Dr. Adam Cohen. Consultation at theartofeyes.com. Dr. Adam Cohen, how are you, doctor?
I'm well. How are you today?
Doctor, I am sorry to bother you. I know you must be well. Are people getting worked on today while the snow's coming down in Chicago or no? In Glenview?
Some are still showing up, yes. It's a mix of some canceling, some showing up.
Okay. So, doctor, we're talking about this swag bag at the Academy Awards.
Sure.
And in the swag bag, they have one of your procedures that you do at this office of yours. And it's called what again?
The Vampire Facelift.
The Vampire Facelift. Now, how is this in a bag? What is it, a certificate to get a Vampire Facelift? And then I'll find out what you're talking about.
Correct. It was an opportunity to undergo treatment with the Vampire Facelift or Vampire Facial. So it's not a product. It was a gift certificate because it has to be done on site because of you have to apply the plasma, as we call it, fresh.
Right.
Sure.
Okay. Hold on a second. So the plasma is the vampire word comes in because the plasma is blood taken out of your own body, put into where? Your face.
Yeah, blood is taken out of your body, and we separate the red blood cells, as they call them, from the platelets, which are used to form scabs. But we found out that these platelets have a lot of natural goodies for healing, stimulating collagen formation, having your skin turn over to give it a lustrous look, and filled with growth factors that actually promote natural facial rejuvenation.
Okay, so this isn't as crazy as it sounds, the Vampire Facelift. I mean, I'm thinking of this, and would you agree with this, Dr. Adam Cohen in Glenview? Would you agree that in order for this stuff to get into the swag bag of almost $50,000, this is a hotsy-totsy. They're not just throwing anything in the bag. They don't want to be embarrassed. So somebody there in Hollywood has had this procedure, or is this relatively new?
It's relatively new, and I'm sure some people in Hollywood have had the procedure. As you know, most physicians who treat patients, especially actors and actresses, have to be discretionary with what they reveal or release.
Sure.
It's growing in popularity. I perform them regularly, and patients have been thrilled with the results. It also allows what we call a filler. You might have heard of Restylane Juvederm to plump up the skin. It allows it to hang around longer. So instead of lasting approximately 6 to 9 months, patients have been getting 13 months, 14 months out of their filler and are very happy to only undergo that treatment at that time.
Okay, let me see if I have this correct. So the fact is, the difference is you're taking your blood. That is
not my blood,
not,
the patient's blood.
Please, doctor, paging Adam Cohen, please give me my blood back. Yeah, I get it. We're not taking your blood. That would be quite a doctor's office.
I know it would.
All right, Johnny, lie down. We're going to have the doctor give you some of his blood. But, doctor, so the procedure is this. I give you my blood. Mm-hmm. Okay, you tell me where I'm wrong. I give you my blood. You take my blood and stick it back into my face that I just took it out of my body.
Well, before we stick it back in, we put it in what we call a centrifuge and spin it at a very high speed to separate out the cells. And what I re-inject is what we call platelet-rich plasma. And this plasma contains platelets, and the platelets have all these wonderful growth factors and all these natural goodies that stimulate rejuvenation.
Okay.
So it's kind of self-rejuvenation without the risk of infection, chemicals, byproducts.
Is there cutting?
There's no cutting. It's a very fine needle that we use to inject it underneath the skin. If we do a facial, we have a very unique transdermal or trans-skin delivery system where we make very small holes in the skin and then paint it on to allow it to absorb to a deeper level.
Well, I know you say we have to be whatever discreet, but I see a story here that says Kim Kardashian's done it.
Mm-hmm. And, this has been used for years with wound healing, orthopedic procedures where they actually have painted on this platelet-rich plasma to stimulate healing and help with healing with difficult wounds. It's used in orthopedics for joint rehabilitation. So it's been around for a while, and now it has some applications within the cosmetic and world of medicine.
How much does that cost you?
To get your own blood taken out. What if I wanted to give my blood to Buzz?
Well, if you're you never know what's cooking in that blood.
That's right. What do you mean? My blood has a head on it.
Someone asked about the procedure. It's between $700 and $1,000.
So that's like once every year you'd have to do it.
Correct. If you do
months.
it with the filler, it's about once a year. If you do a facial, depending on how deep we go with the facial and how much downtime a patient wants, that really dictates how many times a year you have it.
What do you mean? So what do you mean? The deeper you go, the more you do, the more cutting you do?
Well, with the facial, the deeper we go into the skin, the more recovery time there is, the more of a robust response we get. It's kind of if you peel off an onion, if you peel off one piece, you're still on top of the onion, where if you peel off more layers, you're deeper into the onion, and that's the analogy I use. So with a deeper peel, there's more downtime, say for approximately a week, and patients are happy to only undergo the procedure once a year, where if you're more on the surface, patients don't want that downtime for a week, and they come back for multiple treatments.
So $700 to $1,000, you said, a shot to get a vampire. You call it. I don't like the word vampire facelift, though. You think that's giving you well, it's really why I'm talking to you, but I mean, it doesn't make sense to me. The vampire facelift. Why? Just because it's your own blood. I get it, right?
Correct. We're drawing blood, so. I don't know if the creator of it maybe dates back to Transylvania or what's going on with that. But
that's where
I heard there's a long line of vampires up and coming.
But they use that word. I mean, that's part of the package, right?
Yeah, I mean, that's what was in the swag bag. Yeah, because it's in the swag bag. So one of these stars at the Academy Awards, Ben Affleck, whoever, they open this up and they go, "Oh, I can get a vampire facelift." They think it must be a joke, something from Twilight or something, but it's not. It's real. It's a procedure. You're doing it right there in Glenview.
Right.
I wish I could give one away. I said, "Can I give one of these away?" And they said, "You cannot give a face." They call it the vampire face. You can't give that away.
No.
So, doctor, you wouldn't even allow me to give that away.
Would I allow to give one away?
No,
sure.
No, but I can't.
I would allow one.
But I know, but I can't. It's not legal. I can't do it. I can't make people go into a doctor's office. I guess there's some kind of.
What about you? Would you be willing to come on in?
Come on, Johnny.
No chance.
You'll be glowing.
No, wait a minute, wait. What if I go in? What happens to me? Do I start glowing? Buzz said I'll be glowing.
No, you'll be radiant, not glowing.
Radiant.
Just enough.
That's close enough.
Kind of like a light bulb.
I'm not going to glow like a light bulb. I'll be radiant. Why don't you be radiant? Hector, why don't you go get a vampire facelift? Hector, would you go get one?
I might consider it. I'm recording, sorry. I might consider it.
What about Gino?
I don't need one, though.
What about Gino?
We'd be happy to take
Gino! We got to get Gino a vampire facelift. Doctor, that would be great. Well, we'll talk about it, Doctor. That's very kind of you. I don't want to put you on the spot here. If you wanted to do that, that would be great. But certainly we won't hold you to that. But that's very kind of you.
My pleasure.
Very kind of you, Dr. Adam Cohen, a plastic surgeon for the Art of Eyes. It's called the Art of Eyes in Glenview, Illinois. And the new beauty treatment that all the Hollywood stars have now is inspired by vampires. The Vampire Facelift. Go to theartofeyes.com or just and ask for Dr. Adam Cohen. Are you the only one there that does that, doctor, or anyone?
I am the only one. I'm probably one of the few doctors in the Chicagoland area actually performing the procedure, and I am the doctor, the Midwest doctor for the point of reference for this procedure.
Look at you. That's great. That's great. Hello, Eileen.
Johnny!
Yeah.
Hi, how are you?
Hi, Eileen. What can I do for you?
Yours, Johnny.
No, I can't. I can't give you one. It's not legal. I can't do it. I can't. But Eileen,
Ask the good doctor to transfer it nicely to me.
Hey, does that sound like something you understand what he does to you, right?
Oh my God, yes.
Okay, so at the end of this procedure, I want to hear again, doctor. You come out and you're glowing. You said you'll be glowing. Radiant.
You'll be radiant. With the facial, you can really truly see the changes as you leave the office. With the filler, it actually goes underneath the skin, so over time you'll start to have new collagen formation and changes over time. But if you come in for the facial, I've had a facial myself. It reduces pore size, cell turnover, reduces sun damage, fine wrinkles. It really does work.
The Vampire Facelift, wow.
I don't use anything that I haven't tried on myself. I've tried Botox. I haven't done fillers. But before I do something like this, I tried on myself. I was red for a couple of days, but I was very satisfied with the results. And I'm not someone who uses a lot of these products, quite honestly.
That is so weird, doctor, that you do it yourself, to yourself, before you do it to your patients.
Do you actually?
If a patient's going to come in and, trust me and undergo the procedure, I should really see what the results are before they spend money and have faith in me.
Do you actually do it to yourself, or do you have somebody else do it to you?
I actually do it to myself.
Oh, that's creepy.
Wow.
I'm
more impressed by this Dr. Al every moment.
Right.
You put the needles in your own face with this with your own blood.
Well, I work with an esthetician, and she helps me, but I pretty much am able to draw my own blood. It's very, very tiny needles. I should just tell you that. It's less than a mosquito bite, whether we're drawing the blood or doing the facial. And we put a lot of heavy anesthetic cream on, so actually you don't feel the facial when we're doing it.
You don't even feel it. But yet when you come out of it after...
give you a lot of strong numbing cream and let you hang out for 20 minutes, have a cup of coffee, and really, really takes the edge off, and most people don't feel a thing.
Takes the edge off. But, Doctor, then your recovery period again is, let's say you go in there, you get the Vampire Facelift, you come out. How many days would it take for you to be able to go back into the public?
For the facelift, there's actually no downtime. You'll just be the only thing you'll see is a little bit more fullness under the skin, and that goes away within 12 to 24 hours. The plasma absorbs into your body. So with the facelift, there's zero downtime. With the facial, depending on how deep we go, you'll be red for a few days, but there's nothing that some cover-up wouldn't take care of.
Okay, I'm going to see if I could. But the possibility you would allow someone here from the staff to have the Vampire Facelift.
Sure.
Wow. Well, he gives it to himself. That's crazy. All right, so we might send someone. Just let me see. Hey, Gino.
Yes.
Would you get the Vampire Facelift?
I would consider it.
Sure, why not?
Yeah. I mean, I'm not that vain about my general appearance, obviously.
No, but
who doesn't want to look radiant?
Yeah, but you're going to come out looking radiant.
Yeah, I mean, what the heck? Why not?
Awesome. Well, I think I might have put him on the spot here. I just lost him. I cut him up by accident. But I lost him. I might have put him on the spot, so let me find out. But I want to say, if you don't want to do it, I'll say forget it.
Well, let's talk about it. Do we have to do it right now?
No, you don't. You can't do it right now.
Well, I know. That's what I mean. So yeah, we'll definitely consider it.
No. You heard what happened. You heard the whole thing, right? Just a couple of needles in your face.
Yeah, that doesn't sound like a big deal.
No.
What could possibly go wrong?
All right. Hey, what happened to the doctor? Well, just talk to me. What happened to him? Sorry, just tell him, listen, we got to go. Just tell him sorry about that. Thank you very much, Dr. Adam Cohen, plastic surgeon for the Art of Eyes in Glenview, Illinois. New beauty treatment sponsored by vampires.
Uh-huh.
Inspired by vampires. Dr. Adam Cohen, sorry for cutting you off. I wanted to say goodbye to you, though.
Well, I thought I frightened you guys. I really appreciate being on the station. If anybody has any questions, don't hesitate to give me a call, and feel free to stop on by.
And they can look at theartofeyes.com for more info to see what this thing is actually all about, right?
Yeah, there's quite a bit of information on that, and links you to the corporate website as well.
All right, Dr. Cohen, thank you for your time. I appreciate it.
Thanks for having me. Be well. Take care.
You be well. You're a nice guy.
Right.
I like this guy. I like this Dr. Adam Cohen. He sticks himself in the face to see if it works, and then he's going to stick it into Gino. Awesome.